What I'm going to do now is I'm going to show you a short video of myself putting on the HandTutor, and then we're going to go through the actual possible physiological or anatomical movements that the patient can achieve with the HandTutor. So the HandTutor system is has two parts. One of them is the movement biofeedback ergonomic device. Okay, so in this case, the ergonomic device is the HandTutor. Now, what's important is two things. One, it's very quick and easy to put on. And number two, we can put it on with no restriction. So we don't have, if a patient has, for example, limited wrist flexion or extension, we can still put the device on. Now, the third important factor is that we're not limiting the range of motion. And the fourth important factor is that it's a wearable device. That means ourselves as therapists can decide how the patient can be positioned. So for here, I'm assisting the patient, but she's in a sitting position, but we could be working in a standing position or in a lying position. So again, important points are very quick and easy to put on. We can put it on and there's no limits to if the patient has any, for instance, contractures or deficits in range of motion, we can still put the device on. And the third important point, we're not limited by the position of the patient, and we can position ourselves to be able to support the patient. Now here's an example here of some clinical applications of the HandTutor. You can see here what I'm doing is an opposition movement, but I've converted the opposition movement into a grip. So what I'm doing here is I'm doing a thumb and an index finger opposition, but doing a grip movement as well. And I'm using the movement biofeedback as instructions to how quickly I want to open my hand and how quickly I want to close my hand and how much time I want to stay in the grip. So here we're using a different object, and here we're using a tripod grip. So we can do the same movement biofeedback or the same exercise practice, the same repetitions of the grip, but customize it to a different size of object, to a different functional task. And here we're gripping a cup. Now, finally, we're doing the isolated repetitions of opposition movements. And here we're looking at a different size of object and coordinating it with an elbow flexion as well. So we're doing a grip and then we're pulling towards us. So we're here, we're going to do the task, which is going to be the grip, and then coordinating it with a secondary joint. And here we're doing the practice against resistance, either as a grip or single fingers. And finally, we're doing another pinch movement, but again coordinating this now with an elbow flexion as well. What we're going to do now is we're going to give you a brief overview of the HandTutor software and a brief overview of how we incorporate the HandTutor software into a site. Now the site can be a hospital clinic, or it can also be a private clinic, or it can also be a home client as well. So what's very important if we're looking at a hospital site or a clinic site is that we set up the site domain, if you like, within the HandTutor. Now you have a template which needs to be filled out. Now the template allows us to have decide who's going to be the site manager and also who's going to be the supervising clinician within the system, within that site. Now, the HandTutor software is divided up into different dashboards for different users. And these dashboards have a different hierarchy. For instance, we have the site manager. Now, the site manager allows us to set up clinicians. Now, these clinicians can either be supervisors or clinicians. If they are a supervisor, they can build themselves other clinicians. Okay? So again, we have a template and we have a site manager who's designated as the site manager. Now he is usually the administrator or computer IT person. And then we have a supervisor of the clinic. Now the supervisor of the clinic can go in at their specific level in the hierarchy of the MediTutor. And what they can do is they can put different patients into the site. So they can build patients, but they can also build clinicians. Now, the next level down of the hierarchy is the clinicians. Now, the clinicians can also build patients. So when you have a site, it's very important for us to designate more than one clinician in the system. So it's not enough just to have one supervisor, because the software access is on a floating seat system. That means you can only have the clinician at any one time, one clinician using their username and password signed in to the software. If another clinician wants to use that same username and password, you won't be able to go in. So that's a very important point where we have to actually designate a username and password for several clinicians within the site, because each clinician has their own floating site. Now, because each clinician has their own floating site, as I said, each clinician can build their patients or can set up their patients within the database. But it's very important for them to make sure that they give access to other therapists. So what I'm going to do now, I'm going to introduce to you the MediTutor software, and I'm going to just show you what a therapist dashboard looks like. I'm into the system here as myself, Alan Waterman, as a therapist. You can see here that I have a summary of my dashboard here on the bottom left, which is called My Dashboard. If I go into my dashboard, I can see that I have a column here mentioned My Patients. If I click on My Patients, I see here that I have all my patients, which number 60. But I can also show all the patients in my site, which is 86. Now, if there is a patient that I have not treated before, for instance, this patient here, Ori, O-R-I, okay? Now, if I go on to show my patients and look for Ori, then they do not appear. If I go on to show my patients, Ori does appear. So I can select this as a patient, and if I want to treat this patient, I have my patients, I can select, I have Ori, does not appear. So I have to go to show all patients. If I go to show all patients, I can edit Ori, and we have assigned clinicians to patient. Now, if I want to treat this patient, I have to become one of the clinicians who's allowed to treat this patient. So I just click over here, and I'm taking now myself from the list of therapists into the therapists that allowed to treat Ori, and then apply and update. So now, if I show my patients, Ori is one of my patients. So again, I'm going to just reiterate those points. First of all, when we're setting up a site, we have a site formation document where we have to assign a site manager. Now, the site manager is responsible for naming and giving us the information of an initial supervisor. The supervisor has the site manager has his own dashboard, which allows him to add a supervisor. And the supervisor has their own dashboard as well, which allows them to name other clinicians. Each site, you have to make sure that at each site, we give each treating clinician their own username and password. The reason for this is that not all of the clinicians can go in with the same username and password because we have a floating seat system. So only one clinician is allowed in the system with their username and password at one time. Because of this, we have to understand how we assign patients to therapists. Now, what I'm going to do very, very briefly is show you how you set up a new patient on the system. I'm clicking again on my dashboard. I'm clicking again on my patients. And from my patients, I have above here an add button. Now to add, let's put test recording is the patient that I'm going to be calling this one. Test recording, because I'm recording this. And they are the only fields which are mandatory. And then I can create that patient. So very, very simple. Now, if I want to go back and edit that patient, again, I have the edit button. So I can add some more demographic information if I wanted to. If I want the patient to be able to go in as a patient dashboard, that means they're using the system at home for home exercise practice, then I have a section here called Allow Account Login. If I click on Allow Account Login, you open up another two mandatory fields. One is giving you the email of the patient at home, and the second one is giving you the password. If I fill those in and have clicked Allow Account Login and decide how long I want to allow that account login for and update it, I will then give the patient their own dashboard that they can go on with their own dashboard. Now, this allows for home exercise practice with the devices at home, but also allows us to do telehealth as well. And I'll go into some more details later of how we do telehealth. Okay. Now we're going to go on further now to the HandTutor. Now we know that the HandTutor is both size and side dependent. What does that mean? That means that there's 5 sizes for the left and 5 sizes for the right. So that makes a total of 10. Now the sizes range obviously from size 1 to size 5. So we can think about that as an extra small for children, probably from the range of 4 or 5 upwards, to an extra large, to a big basketball size hand. Okay, so we have extra small, a medium, a large, and an extra large on left and right sides. Now what we're going to do now is we're going to show you using the system how we calibrate. Well, we're going to go into the system now. So to go into the system, we're going onto my dashboard and we're going to pull up a patient. So here I'm going to pull up this patient via a demo. So that's one way of pulling up a patient. Another way of pulling up a patient is the way I showed you just previously, is we click on my patients and then that same patient VA demo, we highlight, and we select, and then they are picked up within the system. So this is an example of a clinician dashboard with the patient that they're treating data. So we can see instantly, we have all the times the task that we've worked with this patient is in front of us, okay? And we're going to go on how we update this and how we see notes. However, the first thing we want to do is we can go on to treatments. So when we go on to treatments, we see a list of treatments. Let's click track a target. So I'm going to go back because I probably clicked a little bit quickly for you. So I've pulled up a patient. Again, I can do it this way very quickly, or I can do it through the Patients tab on my dashboard. I'm going into treatments. I'm clicking on a treatment. Now we see here that we have already a HandTutor attached, and it's a size 4 left. Now the HandTutor here appears here in white. That means it's not calibrated to the system. To calibrate it to the system, you can briefly pull each one of the fingers. If you briefly pull each one of the fingers and the thumb, then the system, or you can see that the icon becomes green. That means it's calibrated. Then we can click on the system. When we click on the system, or click on the device, we immediately see a range of motion set up for the device. So to customize the task, we first have to choose on which joint we want to be working with. For instance, we can work on isolated wrists or finger movements. So if we take isolated wrist, we have chosen the wrist as the active joint, okay? Now we then, we can wear the device, and I'm just going to wear it for you quickly, but actually seeing the image of the device is not too important in this demo or this part of the demonstration, but you may be able to see it in the video. So what's important here is that we ask the patient to flex and extend the joint that we're looking at, which is the wrist. So again, flex and extend. Okay. Now I'm going to ask them to do a repetition of this. When you see a repetition of this, you see this line here on the wrist going down and going up. What's very important is I keep looking at my client at the same time, and looking at the software at the same time, making sure that they can actually reproduce this movement. Because if they can reproduce this movement, then it's reproducible within the task. So then I press next. So here we see that when we're flexing our wrist, the ball goes down, and when we're extending our wrist, the ball goes up. So what I've done, I've set up and already beginning to customize the practice. How? I'm customizing it to the joint, and I'm customizing to the range of motion. Now there is a default setting of the instructions. The instructions are saying how quickly and accurately I want to keep this ball, or I want to actually do the extension and flexion. So I'm pressing play, and you can see as I'm extending my wrist, I'm moving the ball up. So the task has told me the speed that I want to move the ball up, and how long I want to hold it up, and how long I want to come down for. Now you can see here that that definitely is reproducible within the task. Okay. If I come out of the software, I get a visual, and I'm actually getting a beeping, a feedback. I'm also getting a progress score, which represents how long I've been in the task for. If I then stop this task, those parameters of the task, that means the range of motion, how long I played for, the score, is now recorded in the database. And that's recorded so that I can annotate it later. So I can keep my reporting and documentation up to date. So I'm pressing close. So the important points are, with each task that you set up, you start to customize according to the joint that you're going to be working with. You start to customize according to the range of motion that you're going to be working with. And you make sure that that is a reproducible range of motion. Now that range of motion, if you're going to be doing active practice, that range of motion can be just done by the patient doing the active movement, or it can also be done by assisted active movements. So that means that somebody else or the therapist is going to aid the client. So that's active assist movements. Or you may be adding FES as well to assist that movement. Or you may be able to do that. You might be able to do that movement against resistance as well. So we're going from completely passive, where the therapist can do all the work, but still getting the movement biofeedback. And then we're going to be going to active assist and also active. So we're going from completely passive to active assist, which could either be through the therapist aiding or through electrical stimulation, to active practice, to practice against resistance. And lastly, if we were going to set up that range of motion in a functional way, then we could add the functional object. I'm going to click back on range. So that's a very important point. All your settings and getting back to the range settings are found here on the bottom left-hand corner. You can see here, we're now doing that functional grip and measuring that range of motion in a functional measure of the range of motion. So again, within that grip, within that function, we're still getting the movement biofeedback. So we've translated the functional task into movement biofeedback. The functional task is gripping the cup. It's repetitions of wrist extension and flexion using making it task orientated or task repetitive training. Okay, so number one, we've customized the task to the joint that we want to be working with, to the range of motion that we want to be working with. And we've made it and we've customized it according to whether we want it to be passive, active assist, or active, or against resistance. So let's go back into range. We were working with the wrist, now we're going to be working with the fingers. Again, we can set up the range of motion according to whether it's going to be passive, so that the therapist is doing it, whether it's going to be active assist, active, or we could be using it, as you saw in the video previously, against resistance. Now we've clicked on fingers, so we're working with fingers, isolated or combined fingers. Now here, I'm going to show you how we can customize the practice to a either to an isolated thumb movement. So here I'm just unclicking the other thumbs, the other fingers, and I'm just leaving the thumb. Again, we're making sure that that range of motion that we produce is repeatable. And we can then do that task with just the thumb. Now, if I want to further customize that task, for instance, we were talking about working with range of motion within the limits, accuracy of movements, speed of movements, okay, and being able to get to a specific part of the range of motion and hold. Now I can further customize by going into the settings document or the settings, the menu bar, which allows me to change the settings. So we're working again on that thumb movement. So now perhaps I want to actually work on burst speed, getting the thumb out, and then slowly work on flexing the thumb and holding while we're in flex. So here I can change all those parameters. So the burst speed, I want to shorten the amount of time it takes me, or the instructions of how long I should actually do the thumb up. We'll leave the hold, the position of the thumb up at 5 seconds, and we're going to decrease the length of time or increase the length of time of the thumb flexion. And we're going to hold for 8 seconds in thumb flexion. Now, I might have a patient who has difficulty with accuracy of movement. So I want to give them a bigger path. So if I gave them, we'll work the reverse. If I gave them a smaller path, first of all, then their thumb movements would have to be very accurate, because otherwise they could easily go out of the path. If I wanted to make it easier for them, I could increase the path size. I can increase also the size of the ball as well. So it makes it easier for them. So here, as I said, we're working on a fairly fast extension of the thumb, and then a slower flexion of the thumb. So we're further customizing the task. Here, as I pointed out in one of the previous slides, we're customizing to the range of motion, but we're also customizing to their ability, and we're customizing to the objective of our treatment. Let's further customize to an opposition movement. So I'm taking the range. Here, if the task has been going for longer than 30 seconds, then it's recorded. Now, we're going to look at an opposition movement, okay? So we can use either a thumb and the first finger, as you saw in the video. That's the opposition movement that I've recorded. Now, if I move these fingers, when I'm in the software, nothing will happen. It's only when I actually do the opposition movement that something happens. So it's only the opposition movement that it happens. Again, if I'm moving these fingers, nothing will happen, just on the opposition. So here I can just, there's the opposition, and here's a slow opposition movement. So that was a thumb and index finger opposition. Going back into the range, I can do if I wanted to do a grip with the index and the middle finger, then I can take the index and the middle finger. I can take off the thumb here, and we can take an object, and we're gripping and opening, gripping and opening. And again, I'm looking at the software all the time, making sure that that actually is repeatable. Press next. Open, grip, open, grip. Again, we can decide how much time we want to do in grip, and we can actually incorporate an elbow flex to make it functional. So again, we're taking the cup. We could either have that cup on a surface, and then we could incorporate the elbow extension flexion or reach movement, or we could pass it off with the other hand. Again, just thinking out of the box how we make this as functional as possible. So we press play. We're opening up here. And here we have to concentrate on taking the cup, as you saw in the video. And there we're on a grip. And here we can incorporate that elbow movement of the drinking. We could either be on the table when we let go, and we open. Now within the task settings, we have the ability to save those tasks and name those tasks. So again, this helps us by allowing us to build to report and to document what we've done and why we've done certain things. So here, if I click on settings, you can see I have two bars, task settings and task list up the top. Now the task list is a recording of my previous tasks, which I've changed, and I've decided to give them different names. So what I'm going to do here is, these are the settings that I've decided were with the cup and elbow flex, okay? So I'm going to save that task with cup and elbow flex. Now you have to be careful here because we only have 20 characters, a maximum of 20 letters, but this should be okay for 20 letters. If I go into task list, I have here cup and elbow flex. Just have I'll do that a little bit slowly for you. If I go into settings and task list, I have two task lists. One is registered fingers. And when I apply that, I have those particular task settings which are registered in that task name. Now you can see this task is different. For instance, it's a extension going up and then an extension hold. And we're going to take this task here, fishing frenzy, as an example. Again, we choose the device, we choose the joint that we want to work with, which is going to be working with the wrist. We're going to do a wrist flexion extension exercise. We could do that with an inner grip. And here you see that my extension is bringing the hook down. And this task is very simple. I'm going to be presented with the fish. The fish are the instructions of where I have to move down to. I have to move down and up within that path, within the up and down, within the range, to be able to catch different fish or different numbers of fish. Each time I capture a different number of fish, I get points. Now, if we have a look at my wrist, if I was in a pronated position, that seems fairly correct, doesn't it? When I go up, I bring the fish up, and when I go down, I bring the wrist down. If I go into the settings bar of my software, we see we have different icons at the bottom. This icon here on the bottom left means revert to the default settings. So even though we had changed all our settings of the game, we can revert to the default one, what was the original one. But this is the icon that I want to show you here. This icon here means reverse the directions. Now, why is this important? Now, an extension is down and a flexion is up. So if I was doing that in a pronated position, that would feel slightly strange. But if I was doing that in a supinated position, that would be more intrinsic, more intuitive. So we have the reverse button that allows us to change the movement of the object on the screen depending on the movement of the joint, depending what feels more natural to the client. So that's a very important button. I go to settings, we have another button which appears, which is change the direction. So here, if we press here, objects are actually going to appear coming from, well, no, the man now appears on the right of the screen. So I've added objects to the right of the screen rather than adding objects to the left of the screen. Now this is slightly different in different softwares, in different tasks. But it means that objects will be coming more from the right-hand side rather than the left-hand side. So this could be appropriate for clients who have some neglect issues where they cannot understand when objects are coming, if you like, from the left-hand side or from the right-hand side, or a particular space within the within the task. So I'm going to go back to settings. I'm going to reset to my standard settings. I'm going to go back to settings and I'm going to reset the direction. Now I'm going to show you how we can now customize our tasks to two directions of movement at the same time. That will be a horizontal and a vertical at the same time. So here we have on the screen a vertical movement. I also want to customize to a horizontal movement and use those two movements at the same time. So if I go into range, I have a button on certain games called Play 2D. Now Play 2D allows me to pick up the range of motion and to use the range of motion on two joints or one joint in two directions. So here we have a vertical axis. So on the vertical axis, we can have the fingers opening and closing, and on the horizontal axis, so here I've dictated that on the vertical axis will be the fingers opening and closing, and on the horizontal axis will be my wrist range of motion. I'm pressing next. So if you remember, we had on the vertical axis my wrist opening and closing, and on the horizontal axis, my wrist extending and flexing, and on the vertical axis, my fingers opening and closing. Now this will allow me to give, first of all, feedback to the patient so they can see what is happening when they make a fist. Perhaps when they make a fist, they're going into flexion, and I want them to keep in a neutral position. So I want them to keep here on the screen. So I want them to keep it here in the screen in the middle and play with the guy in the middle, or play with the guy in extension and then do wrist flexion extension, rather than do the work in wrist extension. So it allows me to give feedback of a secondary joint, of the supporting joint, in this case the wrist. But also it allows me to work on both joints together. For instance, I might say to the patient again, I want you to bring your wrist into full extension and then lift up. So I want you to catch all the fish in this direction. So again, working with 2D allows me to further customize the tasks. Again, further customize the tasks to which joints I want to work, which coordination of joints I want to work, what range of motion I want to work with, and also how to make this as functional as possible. Okay. So that allows us to work with 2D, or two directions of movement at the same time.